Vicky's got something she wants to cover, but we'll just do the opening formalities of the meeting and the minute, and then if you want to come in after the minute before the action plan, Vicky, okay? Yeah. Okay, right, so I'll hand over to you, Arlene.
Okay, thank you. So I'll just remind everybody that the meeting is being recorded and will be placed on sites for public viewing. And I'll now do a roll call for the minute. Pat Kilpatrick.
Present.
Councillor Lynn.
Present.
Councillor Toland.
Hiya, yeah, here.
Councillor McHugh.
Present.
Annie Buchanan.
Present.
Sam Riddle.
Present.
Diane McCulloch.
Present, Arlene.
Thanks. Vicky Irons.
Yeah, present, Arlene.
Dave Berry.
Present, Arlene.
Dr. Wilson. Sarah Dickey.
Present.
Dr. Cotton.
Good morning, yes, present.
Raymond Marshall.
Present, Arlene, thank you.
Thanks. Jim McFarlane.
Yeah, I'm here, Arlene.
Thanks. I've had apologies from Christina Cooper, but Ailsa McAllister.
Present. Yeah.
I've had apologies from Martin Sloan and also Emma Fletcher. Dr. Shaw.
Present.
And that concludes the roll call. So apologies have been dealt with. Item 2 is declaration of interest. Are there any declarations? No. Chair, do you want me to take item 3 now?
Yeah.
Yeah.
Yes, that would be
So
good.
item 3 is NHS Tayside voting member and proxy member. You're asked to note the position.
Okay. Yeah, so that takes us on to the minute of the previous meeting of the board meeting held on the 26th of October. And before we go into the action tracker, I'm just going to assume that everyone has read the minute. And if you have read the minute and if you've got any suggested changes or revisions to that minute, speak now. Nope. Everybody's happy with the minute. Thank you for whoever produced the minute. Okay, so I'm going to ask Vicky now to update us on pressures, and she's got a few things that she would like to get across to the IJB board members, if that's okay, Vicky.
Yeah, thank you very much, Chair. And I'm conscious that committee members will recognise that at times throughout the pandemic process, I took 5 minutes at the beginning of our IJB meeting just to update IJB members on where we were in terms of system pressures. Haven't had to do that for some time, but I thought on the back of the level of... Sorry, is that somebody else needing to come in? No. I thought I had somebody trying to come in. On the back of the experiences we've had across the system in recent weeks, I thought it would be worthwhile just giving a very brief update to committee members at the outset of this meeting. So thank you, Chair, for allowing us to do that. So essentially, we have other agenda items on the agenda today, which look at social care capacity and winter plans. But my main feedback today is on our response to winter pressures. Many of you will have seen probably reports across the media about the level of pressure across the system and the level of demand. But it was just a feedback that recently we have seen a 23% increase in demand for acute care. Last weekend in particular, we had what we describe as the highest take on record in terms of the number of admissions. So we're clearly in a position where we're dealing with a huge amount of surge demand on the system, particularly through unscheduled care streams. It's very clear in terms of the breadth of demand that we're seeing quite a lot of people who are severely unwell, but also very frail. So we're doing work with public health colleagues to try to understand what lies behind that. We always anticipate a surge in winter, but this is beyond anything that we've seen before. So it is causing there to be a red flag across our system. Many of you will know from previous reports that in community services, we've supported a 20% increase in recent years in terms of care at home. And that's as a result of us investing significant additional resources into these areas, but also to quite a significant level of redesign that's happened with the teams that are based in our communities, particularly those teams who work to prevent admission into care for people in their own homes. And credit is certainly due to Jenny and all the team that have been developing those services around us as we speak. In terms of delayed discharge, a snapshot from this week, we have only 12 patients in 9 wells who are in delay, which is a significant improvement on previous weeks. And generally we're on amber, and we're near to our trajectory, which is to make sure that the numbers of patients in delay are in single figures. So we're not too far off that. However, as a result, we're seeing a continued increase in demand, which completely outstrips the capacity that we've got to provide care at home. And I think we mentioned last time we met that at the moment, the level of demand outstrips capacity by 4 to 1. That isn't dissipating at all. It's continuing to rise. So clearly we've got challenges to work with all partners to make sure that people can get access to the care that they need. So I guess I really just wanted to share those as the main headlines, Chair, and really to reflect that the team across Dundee Health and Social Care Partnerships, in my eyes, are pulling out all of the stops to be able to perform at that level. And if you'll give me one more minute, I think it would be appropriate, because this is our last meeting of certainly the calendar year. I think it is worth reflecting that despite the fact this hasn't been a year which has been completely dominated under the pandemic or as a resilience effort, it has nonetheless been a year of considerable challenge for all of our teams, possibly even more so now than under the pandemic conditions. And I didn't think I would ever say that because it didn't feel like it could get much worse. But also for us, it's been a year where we've had unprecedented scrutiny. We've had a lot of external reviews. We've had a lot of requirements to do additional returns and to fill in lots of information for people who are trying to keep an eye on the situation across the system. And I would say one thing about our team in Dundee, they've held it all and they've responded to all of it. And responded really, really well to try and reflect all of the services that we provide under the partnership umbrella. And I think they're due our thanks for all of that. We have had a saying, or I have had a saying, throughout to our team, particularly when it's become really difficult, and that's just to keep swimming. A wee bit of Finding Nemo there. Even if the waters are sometimes shark infested. But I guess what I'd like to say to everybody is to convey thanks on behalf of the IJB for everybody's efforts throughout this year. It's been nothing short of phenomenal. And for next year, it's a case of let's just keep swimming and hopefully we'll turn the corner and understand exactly what's happening in terms of demand. But thank you, Chair, for giving me the opportunity just to make those remarks.
Okay, thanks, Vicky, for that. And I think, you know, we would probably, I'm speaking for colleagues here, reiterate some of the comments you made there about people going the extra mile. And I think we formally need to say, as part of the IJB board, I would like to record as chair that our thanks and appreciation to the extraordinary efforts that our staff have gone to this year to, as you say, keep swimming, keep the show on the road. And in fact, look at the work that they've done now to reduce the delayed discharges and get patients to the right place at the right time. And that's a remarkable feat as well. Many parts of Scotland are not able to do that. And I think we also have to recognise that that takes very good staff, it takes very good middle management, and it takes very good leadership at the top of the organisation. So I would like to thank you, Vicky, and your team for all the efforts and hard work and the extra hours and the extra days and extra meetings and extra returns and all the work that you've gone to keep people motivated. And I would like to thank you and your team. I'd like that to be expressed throughout the organisation as our Christmas message, if you like, from the IJB board. So thank you. I've got a number of other people who want to come in. I think Ken wants to say something, and Annie. Ken?
Yeah, thank you. Yeah, I'd certainly like to echo what you've just said about the commitment and work that's been put in by staff, particularly against the backdrop, Vicky, of the increased pressures that we've been under. These increased figures, is that from the 23 and the 20 demand for acute care and increase for demand in care at home? Is that from this time last year?
I'll have to double check that possibly with Catherine, Ken, but the 20% increase is over the last 2 years, and that's in the hours provided in terms of care at home. Obviously, that's not even kept up with the level of demand, but that reflects the additional hours that we're providing now as opposed to 2020, I think. But I'll come back to you and verify that. The increase in activity of 23% is really just over the past weekend and the past week in acute, and it's just in comparison to a similar period last year and the preceding weeks, if that makes sense. I think a lot of that is hopefully as a result of a real surge we've seen in respiratory illness, non-COVID related, and we're hopeful that there will be a change in that. However, we're informed by some of the clinicians who work very closely with us in the partnership that we've got a significant level of frailty within those admissions to the acute sector, and I don't know if Dr. Cotton would wish to make a comment on that at all. And that indicates there's something else at play here, just in terms of whether there's a legacy of the COVID period in isolation, or whether there's just a step change, if you like, in the impact in terms of demography. But I'm probably not the best person qualified to give a full response in that respect.
Just one more brief question. We'll all be aware of the deterioration in the weather, probably the iciest conditions in a decade. Any signs yet that that's led to an increase in admissions due to particularly elderly people slipping on the ice? I mean, I've personally broken my wrist in the past by slipping on the ice. So I'm just wondering is it maybe too early for any figures on that?
I'm not aware of any at this present time, but again, that's maybe something I can come back to you with in terms of the detail. But we obviously are usually trying to prepare for that. There's quite a lot of public campaigns in terms of social media, in terms of extra efforts that can be undertaken for people to take care to avoid those. But I would agree with you. I think all of us have seen quite treacherous conditions in recent weeks. That's been difficult for staff too, of course, getting in and amongst communities and using pavements to get to some of our clients' homes. So again, we just have to ask for extra caution, but I don't know if it's played through in the numbers, but I can certainly check that out, Ken.
Thank you.
You're on mute.
I said, I do see James is on the call, but I just want to say that I got the figures for last weekend's emergency department at Nine Wells, and certainly the numbers were huge. And as a result, we were struggling to maintain our 90% on the ED, the 4-hour target. James, did you want to comment?
Yeah, no, I think you've reflected that. Yeah, last weekend was a sea change in presentation through the ED and through acute medical receiving unit. The ED unit normally takes about 160 to 180 admissions through the door. They had 265. I think we can also have to be thoughtful, though, that we've had significant public messaging through our paediatric and the media around Strep A, and that has led to significant presentations. In addition to that, the NHS 24 system has been overwhelmed this weekend, leading to a lot of presentations that came through to ED and through to out of hours, and David may want to comment on that. but certainly out of hours was under a lot of pressure, and part of that was probably the NHS 24 performance was not as good. In terms of frailty, yes, Vicky, frailty remains a problem. It's not a sea change than last year, but it's certainly a pressure. And our acute medical unit had 20% admissions, 20% above predicted on Friday, Saturday, Sunday. So it was something particularly unique about last weekend. But obviously that has a ripple effect on to a period of time afterwards. So
Right, thank you. Thanks, James. I don't know if David, did you want to comment before I bring Annie in? Did you want to comment on the out of hours service?
Absolutely.
Just give us a bit of an update.
Certainly.
Thank you.
Again, we had significant increased activity this last weekend. I think in part because of high respiratory circulating viruses, the Group A strep concerns that parents are understandably contacting the service with, and the ongoing pressures in both health and social care, which Vicky has alluded to. We had a 50% increase in our home visiting rate, so it's not exclusively a child-related issue. And this matches up very well with my personal and anecdotal experience from other practices, experience of what's been happening in primary care over the course of the last week. Had really very, very high levels of patient contact. So I think the whole system is cranked up. For what it's worth, this week in practice seems to be a little bit better than last week. I don't think we could sustain those levels of activity if they had been maintained. But as I said, it is possibly coming off the boil slightly.
Thanks, David. I'm going to bring in Annie now. She's had her hand up. Did you want to comment, Annie?
Yeah, it's a wee bit after the event now, but I just wanted to say that Councillor McHugh and I had the pleasure and privilege of meeting with Jenny and some of the teams that keep people out of hospital, and it's really impressive. It's not till you get there and talk to people and kind of see it and touch it that you understand the effort that goes in to keeping people at home and getting them out quickly. So again, just to offer thanks to all, all the staff that are doing all that amazing work.
Thanks, Annie. Thank you for that. That'll be noted. And thank you to Councillor McHugh as well for taking part in all of that. Any other comments or questions at this time, or can we move on to the action tracker? Okay, so the action tracker.
Sorry, Chair, there was also the addition of the agenda note, but we can take that after the action tracker if that's preferable in terms of the agenda.
No, it's okay. Go ahead now, Vicky. It's fine.
So I don't know if Diane is available, but we originally were intending to have an agenda note on the agenda today to update everybody in terms of the Health and Wellbeing Centre. So I don't know, Arlene, if it's possible for us to be able to circulate that, or if Diane, you're just going to speak to that.
I can circulate it. Yeah.
Thank you.
Thank you.
Diane.
Yeah, do you want me to say something? So Arlene Mitchell has pulled this together. Unfortunately, Arlene's suffering a bit this morning in terms of her throat and not able to speak, so I'm going to speak to on her behalf. So really it was just to give an update in regards to Community Wellbeing Centre. People will be aware that the Robinson building went on fire recently. Of course, that was right next to the area where the new centre was going to be developed. As a result, that has pushed back the timescales for the development of the Community Wellbeing Centre. There was an exclusion zone put around the Robinsons while that was actually being dealt with and brought down. We were just about to start work actually on the centre to bring it up to speed in terms of what was needed, and that's had to be pushed back. We are now actually getting into the site and the work is going to start to progress, but it means that instead of the building being handed over in December, that'll now be pushed back into January, at which point we'll start looking at things like refurbishing the building and start to move things forward. The briefing note obviously gives you quite a lot more detail. What we can report is that the recruitment is going on now in terms of a number of mental health service, and I believe that the manager has actually been appointed and will be coming into the service. We'll be continuing to kind of bring things together with a view to looking at an opening date after we have the whole of the building sorted up. So it was really just to confirm that work is progressing, but we've had an unfortunate and unexpected delay because of the fire in Robertson's, but everything is back on track to start working. Happy to leave it at that, Pat, and the briefing note will provide a bit more information.
Okay, thank you for that update, Diane. I think that's really useful. I give members Diane, but it's probably all answered in the briefing note. So if you've read the briefing note, but I'm glad things are back on track. Thanks, Diane. Okay, so can we move on to the action tracker now? There's always a fair amount of debate on this and discussion. So if you've got it up in front of you. We've got a number of items in amber, a couple in green that have been completed. I don't know if members have any comments or questions that they want to ask in relation to this. No. Okay, so a number of things are coming back. Early 2023, the public protection arrangements, the suicide prevention strategy, once it's completed, been ongoing, and we have now the centre's now opened the community custody unit. Is that right, Diane?
Yes, it is, Chair. They have people in the centre and it's working really well at this point.
That's great. It's a great that's a great development. That's a great step forward for people, and well done to everybody who's involved in that as well. That's is that a first for Scotland?
Yes, actually, I think there was another one in Glasgow. Yeah, there was one in Glasgow, but I think Dundee came online first. So yeah, we were the first in Scotland.
Yeah, it's a very compassionate development as well. I'm very pleased that it's open and functional and has got clients now. So if there are no further comments or questions on the action tracker, we just have to accept that. We don't have to do anything else on that. We have to note it, so we have duly noted it, and that moves us on to agenda item 5, which is the Performance and Audit Committee, which Ken chairs. So we have 2 papers there. We have the minute of the previous meeting held on 23rd of November, and we also have the Chair's assurance report. So I'm assuming that colleagues have read the PAC committee, and I'm assuming you've also read Chair's assurance report. Do you want to give us any highlight, Kens, before we open it up to questions?
Not really. It's all there in black and white in the report. I don't know if there's a specific highlight. Just it's all there, basically what we discussed.
Right, all the hard work. So
yeah,
that's great. Yeah, that's good. Thank you very much for that. So we duly note that. That moves us on to agenda item 6, which is the our approval of the Dundee Health and Social Care Integration Scheme. Well, not our approval, but wider approval of that. So we have to note the updated position on that, and the scheme was presented and it was consulted on, and there was further changes and updates, and we've had several iterations of it. It's on the website. Again, I don't think there's anything contentious there. Dorothy, you've got your hand up. Do you like to do that comment?
Yes, please. Just to say, is there a hard copy of this? Is there much changed from the previous one in 2015? I'm just speaking here as a new member of the board, sure. And I wondered whether it would be useful to have a hard copy to look through, and would it be useful to have some kind of a briefing or a bit of training for new members of the board on the scheme?
Thanks, Dorothy. I'm going to ask Dave, because he's been masterminding a lot of this, and Vicky's got her hand up as well. So I'll bring you in first, Dave, if I may.
Yeah, no, thanks for that. And kind of Catherine's been kind of heavily involved in this one as well, as we've kind of worked with the partner agencies to develop it over, well, as you can see from the kind of the number of reports and updates we've brought to the IJB over the last kind of couple of years, there's been quite a lot of iterations of this, as Pat said. So we can arrange to get a kind of hard copy sent to you, Dorothy. That's not a problem at all. And if anybody else wants a hard copy, if you're just going to drop me an email, we can arrange for that. In terms of the Dorothy's kind of question around the changes, there's been a lot of the changes were kind of really reflective of the fact that the integration scheme was written pre-integration, so we didn't really know how things were going to work. And then we've kind of had at that point in time about 5 years worth of experience, so it was really a bit of updating in terms of, so we said this is how it would work, but actually this is how it really works in reality. So there's a lot of tidying up around that side of things. That includes things like the development of the risk management policies and sections and clinical care and professional governance. There's been a lot of kind of tidying up on that. And probably from the main change that kind of came through was around the financial risk sharing, where there was already a clause in around what we would do if there was an underspend and overspend position in the IJB. So basically, if the IJB is underspent, the IJB keeps the money. If the IJB is overspent, there's a number of kind of steps the IJB needs to take before the kind of two partner bodies then need to intervene. So that would include development of a recovery plan, changing the strategic plan, using our reserves, and then it would be a case of, if we're still kind of projecting overspend, then we would go to the partner bodies for them to contribute in a kind of proportionate basis to their input to the budget. The change around that, which kind of came relatively late, and was agreed by the council and NHS Tayside, was if there is a payback, so if there is a kind of a contribution required by both NHS Tayside and the council, the IJB may be required to pay that back over a kind of period of time. So say we were £2 million overspent, and for argument's sake, it was £1 million to the council, £1 million to NHS Tayside, then the partner bodies would then seek a repayment plan from us over, say, a 2 or 3 year period. So now it's down as a possibility, it's not down as a yes, this is what's actually going to happen. So it's just something obviously you need to be aware of as we do our financial projections, that there's a potential financial risk to the IJB in future years if we are overspent and have exhausted all the other avenues to pull that back. So that's probably the kind of the major kind of shift from the previous kind of version to the one that's now been signed off by Scottish Government. I'll pass on.
Okay, thanks, Dave. Thank you. Vicky, were you going to answer Dorothy's question about new members and training?
Yeah. So I think it's become apparent for a whole variety of reasons. It might be worth us refreshing a development session maybe early on in the new year. So I've spoken to Roger about that already, not necessarily specifically on the integration scheme itself, because that might be a wee bit dry, but just to kind of bring in an opportunity for IJB members to attend a session where we can, if you like, just refresh everybody's understanding of the integration scheme itself, but also membership of the IJB. So if that's helpful, we'll certainly get that organised.
Okay, thank you for that. Vicky, are you happy with that, Dorothy? Good. Okay, right. So moving on from the integration scheme, I think we just have to note the updated position that it's now and it's available, it's on the website. Moving on to item 7, which is the Chief Social Work Officer's annual report, which Diane is going to talk to. It's a fairly lengthy report, Diane.
Yeah, thank you.
A lot of work in that.
People will realise that I live in the sunniest spot in Scotland, and I have to say this at every meeting up until about 3 in the afternoon, so the sun just shines right in. One day I'll buy a blind, so forgive me if I look a bit strange on the screen. I'm really pleased to present the Chief Social Work Officer report for 2021, coming into 22. Just for people who don't know, Chief Social Work Officer is a function, it's a statutory function there to provide advice and guidance professionally to elected members members, but more so also to the IJB as required. It's not a devolved function, so it remains responsibility of Dundee City Council to appoint, and it covers both the social work staff and social care staff in children's services and community justice within Dundee City Council. Each partnership has to, or each chief social work officer has to produce an annual report, and the guidelines for that report are sent out from the Office of the Chief Social Work Advisor in the Scottish Government. And so you'll see from the report that it really reflects that kind of wide range of service delivery, both across the partnership but across Dundee City Council. I suppose before we go any further, I really would just want to say thank you to Catherine Sharp and also Alison Lookers, who take responsibility every year for really pulling together the majority of this report. I think if they weren't helping out doing that, I don't know if I'd be able to get one, but I rely very heavily on them to pull together the information to get the report. So thank you to that. It does reflect the financial year, as I say, 21-22, and it reflects a lot of the work that was actually undertaken when we were still in a good part of the pandemic. And I suppose what I would want to say is that, you know, that meant that we continued to be really challenged in terms of the work that we did and the way that we did it, in order to make sure that we continued to deliver the statutory functions that sit particularly across social work, but also that direct line delivery that our social care staff provide. And I think we can only kind of, and Vicky to some degree stole a little bit of my thunder with her statements earlier on this morning, because really we can do nothing but thank the staff for the work that they put in during that period of time, which was really challenging, not just professionally and organisationally, but quite often personally as well, to be able to continue to deliver at what felt at times really quite scary, as well as very, very difficult in terms of capacity, was really quite remarkable that we continued and continued to do so well, and sometime actually improving our performance, but even where it was just maintaining the ability to deliver services, that in itself should be really commended. And I think what also is reflected through the report is that not only did we continue to deliver services, but we continue to do that flexibly, responsibly and responsively, reflecting, you know, changes in legislation and ways of working to ensure that we made sure that people were safe and got the services that they need to be able to continue to live the lives that they wanted. And I guess what I'm saying is we continue to keep people at the heart of everything that we did as we went forward over that period of time. Nothing but admiration for what went on. So the report reflects quite a lot of highlights of our work, but also identifies a number of challenges that we continue to have going forward. That's around increased demand. We really don't understand yet what the full impact of the COVID will be, and the emerging risks that will present, whether it's about increased in substance use, it's increasing capacity in the health needs of people, even in terms of things like our public protection work, because a lot was, as with our best intentions, might have gone unnoticed during that period, and we need to keep seeing and watching and looking to see how that works. We know that we're hitting economic difficulties, both in regards of the people that we work with, so going forward we would expect to see more demand coming in that area, but we're also experiencing and will experience financial crisis across the services that we work in, as we come out of the pandemic and are faced with some of the financial difficulties that will face our organisation. And one of the biggest things for us is going to be how we continue to recruit and retain staff. And again, we're seeing the impact of that. And I think that partly goes back to how people experience working in our services during the pandemic. And so how we continue to support people and engage with our staff to make sure that their well-being is at the heart of what we do. And I guess the last thing is we really don't know what the National Care Service is going to bring. We don't know if that means that we're going to continue to have children's services and adult services working within one framework, or if we'll be in two frameworks, or indeed how that goes forward. What I am confident about is that the staff will continue to work to do the best that they possibly can in the environments that they work in. And that'll be social work, social care. And then because I'm in this forum, it'll also be the staff that work across health within the partnership, because we have a very committed staff group, and they will continue to deliver exceptional care that's person-centred and really based on strong values for doing their best going forward. So the report is there just in terms of process. It's already been to Dundee City Council's Policy and Resources Committee. The report has been submitted to the Scottish Government, including the final version of the report in terms of its public document. It's coming here for information and comment, and I'm happy to take any questions that anybody may have. Thank you, Pat.
Thanks, Diane. Thank you for that. It was an excellent report, and reports you really had to concentrate on and read, because there's so much going on, so much really good work. So thank you for talking us through it, Diane. It's much appreciated. I've got questions, I think, from Siobhan and from Dorothy. So I'll let Siobhan go first, if I may.
Thank you. A couple of small things and then a broader question. I'm just looking at your introduction, and it's point 4.4 at the bottom of page 22, and it starts with a diverse range of positive collaborations between social work and social care services. It's actually the last sentence. I know that it's just a teeny little thing, and excuse me for being quite pernickety. It's the partnership work was also strengthened to the opening of the Bella Community Custody Unit, comma, the response to unaccompanied asylum seeking. Just that comma almost feels like it connects the two together. So it's just a teeny little grammatical error, but it kind of creates an unfortunate connection between asylum seekers and a custody unit. So even if you just put an and there, so apologies, that's just that reconnection. The second thing I want to say is, you know, and this is a really positive thing, congratulations on the COSLA award for the non-fatal overdose. There is a lot of light on the drug situation and a lot of negative light on the drug situation as well, but it does show that we have been doing innovative work, and you guys have been doing innovative work as well. So it's actually a really kind of positive. There's still loads of work to do. I think we all recognise that, but we have to kind of celebrate the positives where they come, and it is a good example of what can be done if the will and the dedication of staff and policy development is there. The final thing is really just a broader thing, Diane. What would you see are the core priorities for moving forward next year?
Thank you. So I think thank you, first of all, thank you in terms of the non-fatal overdose, and I will absolutely make sure that we get that kind of changed in terms of it really wasn't an intentional error. So we'll pick up on that. I mean, the staff in terms of non-fatal overdose has been really quite phenomenal, and I sat on the drug deaths task force, in the Scottish Drug Deaths Task Force, and I actually covered a bit around the NFOD work, and we were streets ahead of the rest of Scotland in terms of that work. So it really deserved, the team deserved to get that award. I guess the priorities going forward, I mean, we need to have a stable workforce. Councillor Toland, we need to have a situation where we know we can recruit staff and we can retain staff and we can deliver the services that we need to deliver. Vicky opened this session by talking about some of the pressures which are in the system and how we need to do that. So we need to keep adapting the way that we work in terms of the support that we need to do and how we deliver that, and how we take account of the fact that we have shifting kind of staffing profiles. So if I think about even things like our consultants and our doctors are very difficult to recruit. So how do we deliver our services in a different way, right down to how do we have frontline staff that are out there hands-on delivering care and support, and the ways that we work. So we need to keep looking at that. And as part of that, we really need to start prioritising what it is that we can deliver and what we can't. So that, I think, will be some of the challenges that we'll face going forward in terms of the way that we need to work. And then the council itself has identified a number of priorities which the IJB would also reflect, and that's around drug and alcohol, mental health services. For me, it's also about our public protection profile and how we support people in that way as we go forward. So I would think those would be some of the challenges and the priorities we would have, but absolutely getting our staffing right it has to be right up there for number one for me.
Thanks, Diane. Thank you. Thanks, Siobhan, for your questions. Dorothy?
Thank you. Just a quick question, Diane, and a comment that this is a really good report. And my apologies, because it came to Policy and Resources already, and I have to put my hand up and say I hadn't looked at it very closely. I think that was the meeting we had 600 pages of reports to go through. So I have looked at it now. so well written, and I've said this about reports that you've presented before for you and your team. So easy to read, well laid out. Thank you for that. As a new member, I really appreciate that. I have a wee query on, well, it's page 39 in my pack. I don't know what it will be in yours, but it's talking about the development of a protocol to outline arrangement for host families receiving Ukrainian children, young people and parents, carers into their homes. Has that actually started, Diane? Is that happening?
So there's been a lot of work actually being done at a national level around protection and how we actually support and work with our Ukrainian people, whether they're coming into hosted situations or whether they're coming in and then moving into tenancies. We've also got a lot of people currently in hotels in terms of temporary accommodation. I'm sorry, I'm not pulling the page up, so I'm speaking a wee bit from kind of my understanding of your question. We have the national work around protection, but also locally we will work with the families which are actually coming into the city to make sure that we are supported. So we have a special team that actually work with people who are placed with hosts and also placed with in their own tenancies. That includes a social worker who will look at things from an assessment. We do an assessment of anybody presenting as a host, and in that circumstances what we would do is we will look to do a safeguarding check. So we'll check all our social work records, we'll seek information from the police, which will include kind of information which is relevant to the situation, and we make a judgment. And if we feel that someone is not suitable as a host, then we'll take it to a panel, and myself and one of the senior managers from housing will actually make a decision as to whether or not to allow that host to progress. So we've got a number of different stages in place in order to both check people, make things are safe, and then monitor that once people are out. The other area of work is actually around unaccompanied children, and they would go into the support and care of children's services, and we would usually work with third sector in order to look at the kind of support plan going forward. So there is work happening at a national level. I can't remember if the report says a local report or not, but I can certainly come back to you and just confirm where that is.
Thank you. Thank you.
Okay, thank you. Yeah. If there are no other questions for Diane, I think the report is just for noting, Diane, isn't it? So we have duly noted that report. Moving on to agenda item 8. Thank you, Diane. Thank you for talking us through it, and thank you for the report. And I meant to say yesterday, well done on the COSLA award. I think that's a great step forward. So agenda item 8, the property strategy. Is that yourself, Jenny? You're on mute, Jenny.
Not going to help, is it? You would think after 2 years on Teams you would manage that, wouldn't you? Thank you, Chair. We're bringing this report really as the final one of the trilogy of reports. So we've obviously got the commissioning plan, we've got the staffing plan, and now this is the property strategy. Obviously, property isn't delegated in the partnership, but we felt we needed to kind of set out our stall in terms of how we use the property that we already access better, and what else we need in order to deliver on the strategic plan. So this is our first attempt to pull that together in a strategy. So it outlines the property that we use at the moment, a number of things that have happened more recently, such as the development of the Crescent and things like that, the community wellbeing hub and other things that are in progress. And it sets out what we feel we need in order to deliver on, I suppose particularly the thread through it is how we better deliver on things like equalities and how we more localise our services in communities. So we've set out an action plan really in terms of the things that we would now like to take forward, and we would then use that to feed into the kind of asset management processes both in the council and in the NHS. Happy to answer any questions about that, and I think we're bringing it for approval, and we're also agreeing that we'll bring it back quarterly to update on progress.
Okay, thank you for that, Jenny. Have board members members get any comments or questions for Jenny on this paper? We have to give an approval of this property strategy. So I've got Dorothy and Siobhan. I'll let you go first this time, Dorothy.
Thank you. Couple of wee things, Jenny, and before we go any further, can I just say thank you. Jenny's arranged, as Annie already alluded, some induction visits for me, and I've been to 2 or 3 places so far. It's been excellent, so helpful, and I've got more. I think there's another one planned early part of the year, so thank you very much for doing that, Jenny. I've got a question on page, well, it's 84 in my bundle. The property strategy subgroup that was established, and I'm wondering, are there any service users as part of the subgroup?
There are not, and I think that's
Jenny?
something we've kind of acknowledged, and there's a bit of work. Not on that group, Dorothy, but you'll know that there's a bit of work being done around the GP premises that's being led by Julia to look at engagement and what service users want about property. So we're aiming to kind of take what comes in from that and see what we can use and then build on that. Happy to have service user involvement on the subgroup and maybe something that we can look at in terms of ongoing engagement. And I think this will come up, as you know, we've had discussions around the strategic commissioning plan about how we refresh and look at how we engage better in future, and that will feed in as well. So taking that on board and agreeing that's something that we need to work on.
Okay, and can I have another wee question, Pat? Sorry to take up time.
Sure, yeah, on you go. Yeah, it's okay, on you go, Dorothy.
This relates to Kingsway Care. I see that they occupy the facility on a rolling month-to-month basis. I wasn't aware of the leasing arrangement and, and how that actually worked. It says in the report, should the leasing arrangement be resolved, this facility will remain operational for another 3 to 5 years, but it seems a bit precarious. How confident are you that we can continue to use this facility over the next 3 to 5 years? I know there's a long-term plan to replace it, but considering the present economic situation, I'm not seeing that happening anytime soon. So
no, that's true. So we have a 10-year lease that's been negotiated recently with the 5-year breakout clause, so it's not particularly precarious at the moment. I think what it is, though, is extremely expensive and not actually fit for the purpose we use it for. And the more money we invest in actually making it fit for people, we've then got to reverse all that when we come out of it. So it is one of these things. I think we moved into there in 2013 for 2 years, and it's now 2022, nearly 2023, and we're still there. But actually, in terms of are we going to get evicted, probably not. It's just...
Okay, I'm reassured by that. Thank you.
Okay. Any other questions? Hold on, I've lost the screen here. I've lost my screen. Exit the full screen. Sorry.
It was Siobhan next.
Siobhan's got her hand up. Siobhan. Yeah.
Thank you. Hi, Jenny. Thank you. A good report gave me quite a good understanding of the whole infrastructure that's there. A couple of quick questions. One that kind of follows on from Dorothy's point. You've said that at the bottom of 95 we need to replace Kingsway Care and Royal Victoria Hospital. Any idea time frames for those? And I've got another comment as well. Yeah.
Oh, sorry.
No, just fine.
Do you want me to answer that one first of all?
Please.
We've set that time scale out in terms of the reshaping non-acute care work. So I'm going to be completely making it up if I give you an exact date, but we do have that time scale laid out, and I'll get that to you.
Thank you.
I think you're talking several years away, though. We're at the process of getting an initial agreement into the government.
Yeah. Yeah, I wasn't expecting it next year for sure. That that's it. The next thing is more of a comment, and that is at the bottom of page 96, and that's about Constitution House, and I think it's a broader point beyond this report, Jenny. But I'm going to be honest, and I know I keep coming up with this. My heart sunk when I read that, because basically it says we need to replace Constitution House when we actually should be already in the process of replacing it. And actually, if my memory serves me correct, the next time we meet, we will be coming up to the year anniversary from the Drug Commission. It says it needed to be replaced within the year, if I'm roundabout. Can I ask, and this is a general question for the IJB, can we set out some time at the next meeting to have an update on that? Diane, I did email you this morning and ask for a bit more detailed update. But I do think that what I seem to be saying is we're just seem to be stuck a wee bit in a rut there in terms of how we're moving forward. And I'm also very clear that, you know, we're all aware that the Constitution House should have been shut many moons ago. No fault of anybody's. That's just life and how can I, you know, how these things work. But the Drug Commission was very clear we need to, for the pushing forward of a better care. So can we maybe just set aside some time for the next meeting to kind of talk about where we're at? How have we set the targets? Are we going to meet those targets? And what's the time frame? That's where I suppose I want it next year, rather than not expecting the other one. Thanks.
Chair, I'm happy to come in and comment.
Thanks, Siobhan. I don't know if are you okay with that, Diane? Yeah,
I am. So apologies, Councillor Tolan. I had a bit of a problem with my Outlook this morning, so I haven't actually even seen your email. But happy to come back.
It was only this morning, Diane. Don't worry about that.
No, that's fine. I guess one of the difficulties we're having is finding an appropriate accommodation that will actually suit. There was some discussions with one of their third sector. I confirmed the other day that they are no longer interested in progressing with that. It really, you know, I have to be honest and say I'm quite pleased about that, because in my mind it wasn't a particularly ideal situation, but it had the space to allow a form of co-location. So we are still looking for something, and the ideal would be that you would find something that would allow both the third sector and the statutory services to come together. There is nothing ideal. There's been a few places suggested, which I don't think will actually help us shift to what we want to shift to. So we're actively looking, but not yet actively finding something that is going to give us something that feels like the right step forward in terms of being able to deliver the services that we're doing. We are moving more to deliver from other service providers. So we were doing that before the pandemic. That got kind of pulled back a bit, but as we're working towards our staffing increases, we will be delivering and back to supporting service delivery in other providers' settings, and we're working through that again. So we've got some options, and things like the direct access clinic. One is being delivered from Constitution House, but the other is being delivered from Wallistown. So we're trying to spread that across as we go forward. Hoping to have a new service manager in as well next year, so that'll build in some additional capacity in terms of support, but happy to bring a more full report into the next meeting.
Thanks, Diane. I think it would be would give board members some assurance if we had a formal report back on where we are in the context of the overall strategy for substance use in Dundee. Ken, did you want to comment?
Yeah, well, that's what I was going to say, Pat, actually. I think that given the next meeting in February will be a year after the report, I do share. Yeah. I mean, I think I've commented previously about my frustrations about the replacement of Constitution House. So I think certainly we should be having a look at that, but we should be having a look at all the recommendations and see where we stand 1 year on. And also, I've been talking to officers recently about our approach to combating. Sorry, this isn't anything to do with property, to be honest. So I'll say it very quickly. It's relevant to drug and alcohol issues. The year of kindness, which seems to be open-ended. No one knows when it started or whether it has started. I think we need to declare the year of kindness next year with a fixed start date and a fixed end date and a launch. And I can already think of at least one person who would be great to have speaking at the launch of that. So I'd like to see that on the agenda for February as well, because we need to do something about that and really make it high profile, because combating stigma is just as important as buildings. So yeah, I think we could have a big,
yeah. I mean, I think to go back to the property strategy for a minute, okay, so I totally agree with everything you've said, Ken, about the year of kindness, and also about what's the overall disposition of services going to be. A Constitution House is going, and where will people get their services, how accessible will they be? So I think we need something to come back. I think the other point, a good point that was in there, Ken, was do we need to take the recommendations of the Commission report and just say where we are on them all? Would that be something that we would be able to do in February, Diane? Would we need that? I think board members are quite keen to see where they sit against each recommendation.
We're actually scheduled to bring the strategy to the IJB in February. So that was discussed through the ADP last week, I think. So there'll be the monthly brief, which should be circulating by the end of this week, which will give you an idea of where we are against some of those target areas. But in addition to that, we'll have the full strategy available for the meeting in February. So I think that will cover all of the bases of the Commission's work, but much more than that in terms of where we're heading.
Okay. Are you happy with that, Ken? Yep. Yeah. Okay. And thanks, Diane. So we have to note the property strategy. I don't think we have to. Do we have to give it approval, Jenny? Has it got to be approved? Yeah, I suppose it has to be formally approved by the IJB. And adopted. Just one last point, and I'm not sure, did you not put a tender out at some point to write your non-acute strategy? Has that been done now? To produce a strategy for non-acute services?
We have a project manager working with us on the Reshaping Non-Acute Care project, and we also have commissioned healthcare planners to help us do the schedule of accommodation for the initial agreement. So that's progressing quite well. I think we're due to bring an update. Again, I would be completely inventing the time when we're bringing it, but reasonably soon. We bring regular updates on that to the IJB.
Right, thank you. Thank you, Jenny. That's very helpful. Okay, so we approve this paper and we'll obviously look forward to seeing updates as we go forward and how each bit of the property strategy will be delivered. So thank you for that, Jenny. That moves us on. I don't know how colleagues feel, but I'm sitting in a very, very cold house here. Even with the heating on, I had ice inside the windows this morning. I don't know if we could just stop for 5 minutes just now, just to grab a cup of coffee and maybe put the heating up. So I would say we could reconvene about 11:05 if everybody's okay. Does that give you enough time? 11:10, 11:05, whenever you're ready to join back in, we'll wait for you. Can we then just go on to the winter plan, which everybody will have read, which is a joined up piece of work. Who's presenting that? Is that Lynn?
That's myself, yep. Thank you.
Good morning, Lynn.
Morning,
pleased
everybody.
To see you here.
So this is a request for the board to approve and endorse the winter plan. It's obviously the annual Tayside plan that all of the appropriate partners have input to. So just a very quick run through of what the Dundee actions are within that plan, most of which I think you've heard before, but it involves obviously the sort of business as usual updating and maintaining of our business continuity plans, looking at what the escalation processes are, some of the work around our discharge without delay work so that we have clear agreed trajectories for both performance, but specifically delayed discharge, which is now beginning to reduce. We have been continuing to work to develop our enhanced care at home service, which is our community urgent care response. And I'll go on perhaps to just give you a little bit of a heads up about that at the end. We have 8 surge beds which have continued to remain open on the RVH site to support capacity and flow. We also have 8 beds in Turriff House, which is supporting step up and step down from our older people's mental health service in Kingsway, as well as some specific respite beds in both one of the private sector care homes and in Mingus Hill House, one of our own care homes. We've continued to support flow by offering interim care placements as an alternative while we still have a problem accessing the amount of social care that we need. So to date, we have supplied 86 interim care home placements, some of whom have now returned home. However, sadly, many of them have now remained in care homes, which we knew was going to be one of the unintended consequences of this. Just as a sort of addition to what's in the covering report, we have today again had to step up some of our business continuity measures in response to the probably unprecedented pressures that we are seeing in the acute hospital at the moment. So in terms of the urgent care service, we have sent out a plea across all of our staff to look at enhancing the urgent care service to work across 7 days, to try again to support community services with prevention of admission in order to support the front door of the hospital. So that's an additional piece of work that's going on today that will look at having specifically our advanced practice workforce and our OT and physio workforce working very closely with the ambulance service to try to divert as many people away from the hospital front door as we can. And that's a response to the unprecedented pressures that we've had last weekend and over the past few days. So it's a request that the IJB considers approval and endorsement of our plan for the winter.
I wonder, is Pat still
I'm
with
off.
us?
She's
Yeah,
dropped off.
No, I'm not. I'm here. I just went off camera for a minute. I wanted to say that I thought the winter plan was excellent. There was a lot of detail in it. Everything's very clearly explained. I can't think of anything, you couldn't think of anything else that you hadn't covered or any eventuality. So any group that might not have been covered by the winter plan. So I'll open it up to questions briefly, if I may. Dorothy?
I'll be brief. I do have a couple of questions, but I'll email them in the interest of time. It's nothing major. I'm happy to approve the plan. And could I just make a comment on the presentation of the report? I can't read the graphs and the tables. They're too small in my printed copy. So hopefully I'll ask if they can email these to me, the graphic parts of the plan. But shall I email you, Lynn, with my couple of questions? Thank you.
That's fine.
Okay, thanks for that, Dorothy. It's good to see such good partnership working, with all the various agencies and the SAS and, all the people that are involved in that and pulling all of that together and getting all those protocols to work together, so that I don't underestimate the amount of work that's involved. So well done, and thank you for coming and presenting it. If there are no other questions today on that, can we just assume we can give our approval, accept the approval and for the winter plan? So we duly note that. Thank you. That moves us on to the agenda item number 10, the management of the social care capacity and flow. Is that Angela has appeared as if by magic on the screen. Good morning, Angela.
Good morning, Chair, and thank you. I'll try and keep this fairly short so it's just open to questions. So we've used demographics to project what the likely social care need would be, and the projections for this year was that the unmet need would increase by 220 hours per month. So if we hadn't taken the actions that are outlined in the briefing, we would have doubled the unmet need by now, which is currently sitting at 2,925 hours. It was prior to the pandemic sitting at 1,800. It bounced very quickly up to 2,800 at the start of the pandemic and has stayed relatively stable in a range of 2,600 to 2,900 over that period. The phasing in of the additional hours is now complete, and we've been increasing the in-house capacity by around 100 hours a week over the last few weeks. So the 1,000 hours that was funded for the 40 posts is now in place in preparation for winter. All the providers are still struggling to recruit. We have been managing to get roughly 1 staff member per week over the last few weeks. So there is some recruitment happening, but not at the pace that we need. So supply is still outstripped by demand. If we can't increase the supply, we need to decrease the demand, which is why we put these preventative and proactive measures in place. It also happens to be the best thing for the people that we're supporting. So a win-win, hopefully.
Okay, thank you for that. It was a good paper to read, and I loved all the graphics. I think it makes things a lot easier to understand for people. So thank you for that. It was a good paper, and I thank you to be, given some credit for all the kind of proactive work that's going on there to, as you say, try and get people to be as self-sufficient as they can and reduce the demand, because you can't increase the capacity. Is there anything that we can do as an IJB to help you with this? Is there anything that you think, why don't the IJB do this, or why don't the IJB do that? I'm just asking you, it's a bit off the... I just sometimes read these things and think, what is it we could do to make this better, or make this work better, or help you better, be more of a help to you?
First of all, I want to thank Jenny for the presentation, because it was Jenny that pulled it together on my behalf. So thank you for that. In terms of the IJB support, I think it really is just about supporting us to be flexible in how we do this, because we're doing some very innovative, creative thinking about how we link different service providers up instead of having one service provider. If 2 service providers have got 1 staff each, we're matching them up and doing things that normally we haven't done in the past. So that flexibility from the IJB to support us to keep doing these measures, that's probably the main thing we need from you at this point.
Okay, well, you have our unwavering support, and I hope that we anything that we can do in the future to help you. I know this is not an easy area of work to work in, and I think your innovative approaches, as you say, have yielded enormous benefits. Dorothy, did you have a question?
Yes, a quick one, Angela, thank you. It relates to proactive outbound calling. I think it's page 179. The team will undertake scheduled outbound calls via the community alarm system to those who may require support. How will you identify these people that need support?
So what the proactive outbound calling is, in the past we have carried out reviews of how people who have community alarm are managing with the system. The proactive calling is a measure that came from, I believe it was Norway and Sweden, where the community alarm team are actually calling all of our users of the service on a proactive basis to start to have individual conversations. How are things going? What are you struggling with? So if somebody's starting to be a bit unsteady on their feet, we're not waiting until they have a fall and call community alarm. We're putting the falls team in earlier in the pathway. If somebody's starting to struggle with meals, we can suggest things very quickly so that their nutritional and fluid intakes aren't dropping off and they're not becoming ill. So it's that kind of proactive work. So the identification is pretty much everybody that is on our lists. But we will try and focus on the ones that are the highest priority and the ones we know are most vulnerable first.
Thank you.
Okay, thank you for that. Okay, so we give approval to this paper, and thank you to Angela for bringing it forward, and to Jenny for doing the graphics and the presentation work. So a joint effort, team effort. Thank you for that, Angela. Moving on to agenda item 11, which is the GP practice provision in Dundee and the provision to consolidate one site by the Family Medical Group practice. And I assume that Shona has appeared as if by magic. Good morning, Shona.
Morning, everybody. David and I are going to do a little bit of a joint act. I think
morning, David.
Particularly given the discussion this morning, I mean, everybody's aware of the pressures on the system, and that includes general practice, as we discussed when we were talking about the respiratory pressures just now. That's a particularly acute thing, but we absolutely recognise the ongoing pressures and demand on our general practice and link teams. And obviously, we're trying to keep practices as sustainable as we can. We don't always succeed in that. And we obviously had the paper earlier in the year, which had culminated in the closure of Rye Hill at that time point because of the ongoing recruitment and retention issues, which we see not just for GPs, but a lot of link teams. And we obviously highlighted that when we were at the last IJB with the primary care improvement plan and some of the progress being limited around the workforce. So Family Medical Group have had ongoing challenges with GP recruitment for a period of time, and they now have an unexpected sort of unplanned retirement, which has meant that their staffing is becoming more critical, and they've reviewed how they feel they can continue to provide the best service they can with the resource that they can at the moment, and that's led to them asking to consolidate onto one site. It's a big practice. They've got about 9,400 patients, and they work between Wallistown and Douglas. They've feel that by consolidating onto the Douglas site, they can provide local healthcare provision and really integrate with the local community there. Douglas, as you'll see from the graphic that we've put into the report, is in the East End ward. It's got the highest levels of deprivation. So having a long-term health facility there with really integrated general practice and primary care is really key, we feel, for supporting that local community going forward. And the practice have already been really quite proactive in terms of building up links with a number of sort of local community and third sector groups, including sort of looking at more proactive and wider aspects of health support. Obviously, there is an impact of this change if it was to go ahead and be supported. So we've done some engagement work. The practice contacted everybody, and we've worked jointly with the practice around this. There's a relatively small number of responses, and we've tried to summarise those in the paper. So there was under 200 people out of the sort of 9,500 who responded. That's actually better than some previous engagement we've done. So it's difficult to know whether the views there are representative or not, but the key issue for people is for those who live further from the Douglas practice, how they would be able to access, because travel can be more costly and more time consuming and just actually physically more difficult for people. The knock-on impact of that potentially is that people would choose to register with another practice which is closer to where they live. And again, we've put a map into the paper that highlights sort of where the current population are consolidated, and there is more in that area around Douglas than elsewhere, but they are spread across the city. Some of the practices that were consulted, so 4 of the 23 practices noted their concerns about the impact it may have on them if they had a significant increase in their practice registrations because of the change. So there's a real balancing act in terms of trying to keep all practices stable. The other side of that is actually it gives people that currently live in Douglas the opportunity to get better healthcare closer to them. So it may be that we see some of the practices that are negatively impacted by people registering moving to Douglas as a sort of a balancing, and we're seeing that a little bit already. So we're sort of linking quite closely with the practice about the numbers. So some people are leaving the practice, other people are registering with Douglas, and they've seen an increase in the number of registrations with the practice, and we think that's just the opportunity that this is highlighted in the coverage there's been. So there's a number of key things in there. I know David wants to add just about some of the context for this, but I'm aware of Dorothy's comments earlier about potentially the scheme of delegation. So it's the contract for general practice is held by NHS Tayside, so it is a NHS Tayside board decision, but we feel it's really important that we have a view from the IJB, and the paper is going to NHS Tayside board tomorrow. So for those of you that sit on both, you'll kind of recognise the information. Hopefully we've tried to keep the papers as consistent as we can for tomorrow, but it's good that we've been able to come here today first to discuss that. David, do you want to add to that?
Sure, just a few things to say. I guess first off, Family Medical Group has been under significant pressure over several years. Their list size has dropped over the course of the last 4 years by about 750 patients. That's in part because they found it quite difficult to recruit. We've assisted them through the Career Start programme, and that's added a bit of stability. They've also had significant ongoing issues, as Sean has alluded to, with regard to their phone system, which means that they can't actually cope with the patient numbers due to administrative reasons, all going through a bottleneck that unfortunately can't be expanded. So we think that the move to Douglas should allow a locally based practice to fill that gap that we have that sits between that group of practices that sit in the middle of town and Broughty Ferry, where there is no other practice south of Whitfield. So I think this is very much in keeping in making sure that we've got a strong community practice for what we hope will be a strong community. We think it'll be a more sustainable practice, and we think it's a model for ensuring that we've got that closer linkage between community and practice, which can then also link with all the community services that exist round about the practice, so we can get that sort of more holistic working together for the patient. And I'll stop there.
Thanks, David. Yeah, we've been through the paper. We've seen the paper. As Shona says, it goes to the board tomorrow. I think it's relatively straightforward, but I don't know. There might be lots of questions on this, so I'll open it up to Ken and Annie and Dorothy. Ken.
I don't think I was first in, but given the time, I won't argue about that.
I'll let you go first.
I think, given the circumstances, what's happening with this practice, you know, what they're proposing to do makes sense to me. And if they have to close one site, I guess I would prefer it was the site in Stobbswell, given that the bulk, if you look at the data heat map, I think shows that the bulk of patients are in the northeast part of the city and Douglas and close by. So yeah, it does make perfect sense. But you know, I'm worried about the continuing contraction and GP services in Dundee. We've already had Rye Hill earlier this year, and I'm just wondering what, to use a medical term, what the prognosis is for the coming year. Do we have other surgeries? I mean, this maybe isn't the right place in a public forum, you know, but how's it looking for the next year, basically?
There are, as you say, Ken, a number of practices that currently have closed lists. We do have, I think, an active approach to try and manage problems as they emerge. It's very difficult to predict over the course of the next year, but I would say that certainly you're right to highlight that there are ongoing stresses within general practice.
I mean, this is not, David will keep me right here, but this is it's a UK phenomenon. It's not a Dundee issue, and everywhere you go, it's the same in big cities and small cities and rural areas. So it's harder in rural areas, I suppose, because they've got you know, scattered populations. But it's not a Dundee phenomenon, and we're probably actually doing better than some places are. And some of that will be down to the organisation and the leadership and encouraging people to, you know, come forward with their proposals as to how to keep things sustainable. But sustainability of general practice has been in the headlines, on the news. You know, it's a big issue. And I think the Cabinet Secretary did meet with GPs in Glasgow and the BMA a couple of weeks ago to discuss these issues. So I've got Dorothy and I've got Annie. Dorothy.
Thank you. I agree with Ken. I think this is probably the best option that's on the table at the moment. I see it's NHS side's decision in any case, but I had a number of questions on this, which I'll not ask just now. I've got a couple of wee things I'd like clarified. Section 4.2.4 in the report talks about the pharmacy team having concerns, and clearly they're concerned for the security of their jobs. And I wonder what level of engagement was there with staff, not just in the pharmacy team. I think there are other teams working out of Wallerstown. What level of engagement has there been with the staff and their representative, their trade union representatives on these proposals?
If I can come back, so the teams, the rest of the teams, so the pharmacies, not our employed pharmacy staff, it's a community pharmacy, so it's an independent business. So we've linked with the manager there, and we've had quite a bit of discussion around their feedback. Because obviously if they've got a decreasing workload, it does impact on their income. But equally, community pharmacy is very pressurised, and we've got lots of gaps in terms of community pharmacy roles. So people, if the needed fewer people within the pharmacy, we feel would be able to be sort of moved to other pharmacies elsewhere in the city and help with capacity there. None of the other teams in Wallerstown are impacted by the GP change, so everybody else will stay. There's no other teams who are moving out of the building. It's literally the practice staff that are moving. Everyone else is staying as they are.
Could I ask a wee follow-up? Another question, sorry. 4.3.9, I think, talks about patient pathways possibly being adversely affected. Could I hear a little bit more about in what way might they be adversely affected?
Shona?
I'm just reading what I've written.
Just in the interest of keeping this relatively brief, can we ask you to come back to Dorothy online? Can we take that question offline? Is that okay, Dorothy?
Yep.
Just so she can give you a more full explanation, either by phone or by...
Yeah, it's literally just around if people are previously coming and dropping off a prescription in the building, they'll still be able to do that. It's just that the practice team won't be there. So there's more steps in the pathway. So there's more points where the sort of prescription requests and that kind of thing could potentially be disrupted. But the practice are linking quite closely with the pharmacy to minimise that.
Okay, thank you, Shona. Annie?
I think, Chair, part of how we manage this, I'm thinking of the communication side of things. I think it would be key to emphasise the inequalities side of things and how, you know, consolidating the practices, moving it to an area of multi-deprivation. I think we can't influence how the media report things, but I think we should attempt to make it as good a news story as is possible, given the debate around sustainability of primary care. I think that's really important.
Okay, I think the comms teams on both organisations will handle how this is communicated to patients and the explanation for that. So that's the way things are managed.
I was thinking more of the media, Chair, in terms of you know, the local courier and things. So yeah, that's
well, they handle that, Annie.
Yeah.
They'll handle the interface with the local newspapers and local radio, and I mean I think it will go out everywhere after Rye Hill. So I think you're right. We need to have a carefully thought through, controlled release of information to the media. Okay. So moving on from that, if there are no other questions on agenda item 11. We have to approve it, so I'm assuming the IJB approve the content of the paper, the recommendations and the plans and proposals put forward. Okay, I don't see anybody shaking their head, so am I assuming approval? Yeah. Okay, moving on to agenda item 12, we've got the financial monitoring position as of October 22, and that's Dave's paper, and I see Christine has appeared. So good morning to you, Christine. I take it you're going to present the paper and Dave is going to hopefully take any difficult questions. Is that how it's going to work?
I'm sure there won't be any difficult questions, but if there is, I'll pass them on to Dave. But yeah, I'll
Sure.
pick up this paper, and then Dave will pick up the next couple, although they all kind of sort of feed into each other anyway. So as you're saying, this is our financial position, our standing report based on the position at the end of October. At that point in time, we are projecting an underspend of this year of just over £2 million for 22-23. That includes the updated and increased cost implication for council pay award, which has now been agreed and paid. We are still expecting some additional funding from the council to partially offset that, but the actual value of that hasn't been agreed yet, so we'll bring that back to next meeting as and when we've got those numbers. As you'll be aware, the agenda for change for NHS staff, a pay award, hasn't been agreed yet, so that's still obviously going through its negotiations and ballots. But we do continue to assume that that cost pressure will be fully funded from Scottish Government additional allocations, so that won't add anything, any implications to the bottom line. Couple of things just to highlight from the overall position in 4.3.4. Our GP prescribing and other FHS prescribing is contributing to the bottom line by about £1 million. So that's obviously a major shift from a couple of years ago. And in 4.3, there is a one-off benefit, or non-recurring benefit just now, of returned unspent funding from our contractual providers of about £1.4 million from last year. So as I say, that's non-recurring, and we can't rely on that for any future year. Our COVID spend remains sort of stable at just over 5.3 million. That will be fully funded from the reserves balance that we hold. And as we've already highlighted in previous reports, any unspent balance from that funding will be returned to Scottish Government to redistribute across the health and social care sector at the end of this financial year, so that funding will disappear at the end of this financial year one way or another. We are continuing to work with the managers and the teams in terms of the underlying costs that are currently being funded from the COVID spend before as we're moving into the new financial year to address that or capture that as an ongoing cost pressure. In 4.6, the committed reserves balances have been updated after our last meeting, where we've identified another ring-fence reserve. And we've already noted as well that a significant portion of the committed reserves will be utilised during this financial year. So a lot of that funding will be significantly reduced. So the report's just basically highlighting the updated position, asking you to note that. And it probably is introduction for the next couple of papers as well. But if there's any questions, happy to take them, or difficult ones, pass them to Dave.
Thank you, Christine.
So can I sorry,
yeah,
Pat,
of course, Dave.
Just kind of a couple of things to what Christine's just kind of gone through. So in relation to the COVID reserves and the position there, just to give the board the kind of reassurance that when we're expecting Scottish Government to actually kind of formally write to us within the next kind of couple of weeks to seek the recovery of any unspent COVID funding. But what they have kind of given us is the assurance that none of the IJBs across the country will then be financially disadvantaged should our projections for COVID spend to the year end be different from the actual position at the year end. So say we said, well, we are going to hand back £10 million worth, and actually it turns out we're £500,000 short because something's come along we didn't pick up. They've given us that assurance that no, we will make sure you're fully funded for that COVID spend. So that should give the board some reassurance that there's not a financial risk kind of around that side of things. So but again, as Christian says, we'll kind of note that back in the report that will be presented to the February committee. So see Dorothy's got her hand up. So
yeah. Thank you for that, Dave. Dorothy, have you got a question on the finance?
Yeah, 4.4.4, and listening to what Christine has already said about the pay awards and funding for the pay awards, 4.4.4 says that local authorities have received some additional funding from the Scottish Government to support implementation of the pay award. And the last sentence says, therefore, funding for this is expected to be shared with Dundee IJB to partially offset the increased cost pressure. So I'm not clear. Whatever the pay award for health workers comes out at, and I'm not even sure if that's what this is talking about, will it be partially or fully funded by the Scottish Government?
Okay, so I'll pick that one up, Dorothy. So this is in relation to the actual council pay award itself. So as part of the kind of settlement that was reached with kind of trade unions and kind of COSLA was kind of part of that funding, additional funding from Scottish Government. So there's kind of two elements. One's £140 million worth of additional cash, if you like, that's kind of gone through. And there's a further 120 million, which is kind of linked back to kind of being IJB, and council's been able to be flexible with capital funding and how that's kind of used. So in terms of the actual cash that's kind of coming in, we are kind of expecting that we will receive as an IJB our fair share of that funding, and we're still kind of just working that through just now because the pay award, given it's been agreed for the council and has just been paid, we're kind of working through it to see, well, what was the actual impact of that up to now, and then what will it be to the year end? And that's how the council's corporate finance will then say, and this is how much money you would get for out of the £140 million to kind of cover that. It's the only promise we've been given is around 140. The pay award, that I think that worked out as something like 1.5% of the total pay award would come from that element. So in terms of how it's kind of made up in our budget, we had a 2% assumption in our base budget. The 140 million share would be around about another kind of 1.5% of that. And the headline rate, as you'll be aware, for the council pay award was a 5% pay award. So at the moment we've got 3.5% towards 5%. So it's going to partially offset that. As we're working through the figures, though, because the majority of our kind of payroll is actually lower paid staff, the impact, because it's a kind of tiered approach, is actually it's higher. So 5% is actually quite low. We think it's around about 6.1% is the actual impact. So we're just kind of trying to unpick that now that the figures have come through and what that actually means and what that'll mean on our budget. Because the other thing that will be a partial offset is the change in the national insurance kind of contributions, which could have happened at the beginning of November. So we get a little bit of a benefit for the fact that the national insurance cost comes down for us as well. So we're kind of just working it through to see, well, what is the net position on that. So hopefully that kind of helps a bit in terms of some clarity on that.
Yes, thank you.
Okay, that's clarified that position. Are there any other questions on this paper? We have to approve it, so I'm assuming that members are happy to approve. Okay, duly approved. Moving on to agenda item 13, which is the board budget development work that's ongoing based on the budget for 23-24. You said in this little section under that, and there isn't a paper on this, though, is there? I didn't see a paper on that.
No, sorry. So this is just the budget. The Scottish Government budget will be announced tomorrow. So we'll have a good indication tomorrow of what the settlement is likely to be from an IJB perspective. So if that's so that might be about specific additional funding that might be identified for things like in the last kind of couple of years we've had things like living wage additional funding and free personal care and any other sort of new initiatives the Scottish Government is looking to invest in around capacity, etc. So we'll find out tomorrow what that's going to be. So it probably wouldn't be worthwhile putting a paper to you just now that actually doesn't have all the answers in it. It would be kind of part of the equation. So
you don't know. It's just be conjecture really at this stage.
So what we'll do, so as we've done in previous years, because I appreciate there's a number of IJB members haven't been involved in the budget process before, is that we set up a series of private development sessions with the IJB. So we'll kind of take you through a lot of the detail, so you've all got a good understanding of what are the pressures on in the budget. What's the funding that's coming in? How does that kind of relate to the pressures? And then if there's any financial gaps, how we might want to kind of try to, what steps we might want to take to try and kind of close the financial gaps within the budget. So we do that in sort of kind of usually a kind of January, February, March private session, and that kind of works through the same process as, so the local authority will be going through the process of kind of setting its council tax, its budget. So we'll get information from them around what their intentions are around the delegated budget, and similarly from an NHS perspective, we'll work with Stuart Lyle and his team around the detail of the Scottish Government settlement and what it means to our kind of particular services. So it's a kind of joint bit of work in it, and then we'll have ultimately we'll kind of hopefully approve the budget at the end of March as an IJB going forward. So it's really just kind of a kind of short note just to kind of outline that process and where we are in terms of financial, in terms of the budget allocations.
Okay, so the detailed paper will come in February, Dave, yeah?
Yeah, so we'll work through that as part of, so there'll be a more detailed paper in February which will reflect, here's the pressures that we've identified, and here's the sort of kind of a range of additional funding that we've got. And then in March it'll be a case of where the IJB wants to invest its resources, and where if there's kind of savings and kind of efficiencies required, where the IJB is willing to look at for those to kind of basically close the gap.
Okay, okay, thank you for that, Dave, and explaining all of that. And yes, it'll be interesting to hear what Scottish Government announce tomorrow in their financial plan. So we wait with bated breath. I'm not sure how good it will be because a lot of financial pressures, isn't there, in the system. So we note that update, Dave, and that moves us on to agenda item 14, which is the joint the IJB reserve strategy. So I'll let you do that one.
Okay, thanks for that, Pat. Yeah, so we've presented the IJB's reserves investment strategy for you today, kind of for a number of reasons. Part of it kind of linked back to the budget in terms of some of the challenges we're likely to face over the next financial year, but also to reflect that one of the external audit recommendations that was reflected in their annual audit report that was presented and approved by the IJB, by the Performance and Audit Committee last month. And you'll see I've quoted there that they've kind of, the recommendation is that we should develop a reserves kind of strategy, so that the board is quite clear in terms of what it wants to do with the funding it has at its disposal. So within the report itself, I've actually kind of set out a kind of range of issues that the IJB will need to consider going forward, and part of it kind of ties in with the discussion we had earlier, Dorothy, in terms of the integration scheme and the detail of the integration scheme and the risk sharing. So in terms of developing a reserves investment strategy, we need to consider all the kind of possibilities that might kind of result in us having to kind of use our reserves in future. So there's a number of reasons why it's kind of good practice for us to actually kind of set out quite clearly what we as an IJB want to do with the funding. That it's non-recurring. Once it's gone, but it's about how we will invest as an IJB for the benefit of the IJB's strategic priorities going forward, which will be quite clearly articulated again in the strategic plan, and that we'll bring back to you at the end of March as well. So set out there, kind of set out the position, and again, what's kind of repeated anyway from the financial monitoring report. We know there's a whole range of reserves within our overall total that are actually kind of very kind of specific, and a lot of them are tied in with Scottish Government funding. And the kind of the approach of Scottish Government this year has been very much to encourage all IJBs across the country to utilise their reserves before they draw down in-year grant funding for some of those issues. So primary care improvement, mental health in particular, ADP funding as well they're the sort of kind of areas where they're saying if you use your reserves first, spend them, and then draw down the funding that you need for this year. So in effect, the reserves balance will naturally dwindle come the 31st of March anyway, because we're spending money that we're not getting additional funding, and we have to use what we've got just now. COVID funding we've already kind of talked about kind of about the last report as well. And then in addition to that, we've already as an IJB kind of made some decisions that will utilise reserves to kind of again through either additional capacity in the system or to kind of meet some additional pressures that would otherwise hit us in year. So one of the big ones there is the transformation from analogue to digital telephony, which is obviously something we don't control, but it will have an impact because our community alarm systems are all based on analogue, and they need to be switched over to digital. So these are decisions we've already made as an IJB, and that kind of takes up more or less £29 million of our £39 million worth of reserves. So we have the kind of uncommitted balance, 9.6 million. It's by far the biggest balance we've ever had. And I've set out within the report where I would suggest that the IJB needs to kind of look at for financial sustainability. So recognising Scottish Government will kind of continue to monitor and ask us to look at the earmarked reserves. We have got interim care funding in that kind of sits as part of that £9.6 million. We didn't actually earmark it. We probably should have, with hindsight, have kind of said, well, actually, that is for something that will continue into from 21-22 to 22-23. I've set out there that we're actually kind of spending that money. So we kind of look for the IJB to kind of ring fence that money so it doesn't hit the overall sort of bottom line in-year projection for the IJB. We've already kind of just on the agenda today discussed winter pressures, and following on from that, looking to kind of set aside £1 million worth that will allow Jenny and her team to be able to kind of do what they need to do around winter pressures. So if there's additional capacity they can find within the system, then that gives the team kind of the opportunity to go and do what needs to be done to support our service users over that period. As we'll kind of discuss when we kind of go through the budget itself for 23-24, there's going to be, we all know that's going to be a really tight kind of financial settlement with all the pressures that are around and the availability of public funding. So the likelihood is we're going to have to undergo some major transformation to kind of enable us to set a balanced budget, not just for 23-24, but kind of future years as well. To enable us to do that, as with most organisations, kind of seeking approval to kind of set aside a transformation fund, which would kind of help services to really transfer from one type of service to another, if that's what was identified. And again, some of the transformation infrastructure you need around that, whether it's around dedicated project support or just additional capacity in the system to support that. And again, we would put things forward to the IJB in terms of we would like to spend this from the transformation funding. We're also recognising that we have a limited kind of infrastructure in terms of the management team and support functions, and there's an awful lot, as you know, of work to do. Even from today's agenda, we've got a national care service on the horizon as well. There'll be a lot of asks of us to kind of to start to kind of move, kind of get the preparations in for whatever that looks like. no doubt over the next kind of few years. So again, asking that we set aside some money to enable us to kind of provide the support required. In terms of the budget itself, I'm also suggesting that we kind of keep some money, and we'll use that for next year to kind of help plug some of any financial gap that we've got. So again, it's non-recurring, but at least kind of gives us a bit of breathing space for next year. And get really anything else that we as a management team identify during the year and kind of future that we think needs to be invested in. We'll make those proposals to you on an ad hoc basis on that. It would certainly kind of reduce our reserves, but it's making sure we're using those reserves the way that the IJB needs to kind of use them. And if the current financial projections are going to ring true by the end of the year, we'll in effect replenish some of that reserve at the year end as well. So I've kind of gone into a bit more detail there than I planned, but I think it was important just to kind of explain the thinking behind that. So I'm happy to answer any questions.
Okay, thank you for that, Dave, and thank you for the detail. I think it was really helpful for us all to hear that. And some of the issues and the challenges, and it's difficult to forecast what's going to happen in the future all the time, so you need reserves to back you up. I think we all understand that. Are there any questions from board members on any of the points that Dave has raised? Any questions, points of clarification? I think you've wowed us all with your reserve strategy, Dave, so we're run out of words here. We're lost for words. So if we don't have any questions or points of clarification, if you do subsequently go away and think that, oh, I should have asked Dave that, obviously please email him, and he's very good at responding, always responds to me very quickly. So apart from that, we just have to approve the paper. So I'm assuming
Dr. Cotton's got his hand up.
Sorry.
I think James Cotton's got his hand up, I think.
Yes. Yeah, sorry, you're not on screen, James. Yeah, have you got a question for us, James?
Doesn't seem to work just now. Apologies. It's a very quick question, Dave, and it was around. We just heard very eloquently at the beginning of the meeting regarding the pressures we're facing for this winter, and how confident are we that the resources set aside for managing this winter will meet the challenges that we have ahead of us, thinking about some of the delegated services through our acute services, and should we be putting more resource to that?
Okay, thanks for that, James. Yeah, I mean, as I say, we're setting aside a provision within the reserves to kind of support that. I mean, it kind of reflects the sort of levels of investment that would have been provided through the Unscheduled Care Board in kind of previous years. That funding is not available, so it's almost like a bit of a replacement. I suppose the issue is more about how much how much additional capacity can be purchased or delivered within that kind of particular over this particular winter. And what would suggest though is that we earmark it for the £1 million for this year. However, if it's not all spent, we keep that in reserve for kind of future challenges, because I think we all recognise now that winter's lasting a lot more than what it used to. It used to kind of cover. It now covers more or less the whole year, so it's kind of a bit more of a kind of an overall response there. But I see Jenny's come in; she might be able to give a bit more detail on that.
Yeah, I guess the question was in relation to the degree of confidence we've got in our plans to help us get through winter, and that's kind of a difficult question in that we tend to get 2 steps forward and get about 3 back. So we've got a number of things at the moment. We've got surge beds in place in RVH. We're looking to open more in Redwood and McKinnon to support that. We've got the intermediate care unit. Angie's outlined the additional capacity in social care. The will it be enough question, I would highlight that our demand is still outstripping our capacity to supply that. So it's going to be difficult. I don't think there's any question there's challenges around this, and we need to be doing things radically differently to get through this. So I know that the team have been meeting this morning, James, looking at, can we boost the capacity at the front door, looking at frailty Can we do more around prevention of admission and ramp up the urgent care response in the community? Can we look to have an allied health professional presence in ED? So the team are continually looking at how we can make these improvements in the system, but you know, absolutely no doubt this is going to be the most challenging winter yet.
Yeah, thank you, Jenny. I understand. I do understand all the work streams that are going ahead, and I just want to just probably call it out for the board that, you know, this is going to be a very difficult winter. But thank you for that.
Okay, thank you for that, James. I mean, I think we're all seeing the trends, and it's probably only going to get worse. And it usually gets worse in January when we hit January, February. I don't know if there's anything. I mean, the winter plan is robust. I don't know if there's anything else that you could do that you're not already doing. So, and there's significant investment and additional investment into the winter plan. So in terms of the reserve strategy, the board accept it, it's approved, and that's duly noted. I'm moving on to agenda item 15, and we just have all the attendances for the various meetings. If there was anything inaccurate there, or you've been put down as absent when you weren't absent, then can you please indicate that to Arlene, and she will alter it accordingly, Ken?
Yeah, just looking at that attendance sheet, and you know, highlights the fact that we haven't had a carers rep since February, and by the next meeting that'll be a whole year.
Yeah, we've raised this before, Ken, haven't we?
We have, yeah. I just wondered if there was any update on what we're doing, or if we could do anything.
We got an update, Vicky? Yeah, have we got an update on that, Vicky?
I think we have had the carers rep, but
I think it's the service user. It's the service
yeah,
user
it's because we've got Martin as the carers rep, so it may be the service user.
It's the service user.
Is that correct?
Yeah, that's what I mean. Sorry, the user rep. Beg your pardon.
It's the service user. Yeah. We did have somebody. Did we have somebody? Because it's ticked in. It's ticked away back.
We had Linda Gray. Linda Gray left in March, I think it was.
I think.
Yeah.
Right. Okay. Okay.
I know that Willie has been in touch with NHS to decide, because that's the traditional route that we get. We've had the sort of service user representation, but I think we probably need to kind of look at a different route now, because you're right, it's a very long time without having that key member of the board around. So I'll pick up with Willie when he's back from leave and see if there's an alternative option to make.
Is there not a kind of umbrella body that we could go to, where service user from various different aspects of the service, you know, come together? I know, you know, like we've obviously got the voluntary organisations, that different, but I don't know if is there somewhere we can go to and ask them to canvass for people?
So normally NHS Tayside, as I say, takes care of that element, but I think we've just had a bit of a delay in chasing that up in terms of getting the representative identified. So if you're okay with that, Dave, yeah, we'll chase that one more time, and if not, we'll have to look at alternatives. So.
Right, so we'll leave that as an action for the February meeting, an update on that. Maybe we might even have somebody in place by then. Apart from that, I'm assuming that the meeting schedule is correct. And then we have the meetings schedule for the coming year. So they're all listed on the agenda, as just for your diaries, to put that in your electronic diary. And then we've got the meetings for the Performance and Audit Committee, which Ken chairs, for 23 as well, which start in February. Apart from that, suffice to say, the date of the next meeting is Wednesday, the 22nd of February at 10 AM online. If nobody else has got any other points or questions, anything they want to raise, I just want to wish everybody a very Merry Christmas and a very happy New Year. And I won't be here in January, so Ken will be sort of standing in for me. I'm about to go and see my two boys that I haven't seen for 3 years. and my little granddaughter that I've never actually met, who was born during COVID out in New Zealand. So hopefully I'll be basking in the sunshine, but I will be thinking of you all in Dundee, working away. And
Sure you will.
hope it goes